Welcome to the Tech Sharmit podcast, where technology is not just news, but the roadmap to the future. This is a space where we explore the latest tech trends, AI, startups, gadgets, and the ideas that redefine the way we think. Leading this conversation is Amit Sharma, globally recognized as Tech Sharmit. A technologist from Bharat, Amit brings an Indian perspective to the global technology landscape. With deep technical expertise and strong industry insight, and for his contributions and impact within the global tech community, he has been recognized with several prestigious honors, including Google Developer Expert, Microsoft MVP, IBM Champion, and Planet Mainframe Influencer. Through this podcast, he shares practical knowledge, real-world perspectives, and globally relevant thinking designed to help you stay ahead in an ever-evolving technology landscape. Before we begin, make sure to subscribe to the Tech Sharmit channel to stay updated with future episodes. And if you're looking to level up your skills, don't forget to explore the Tech Sharmit digital course book in the description box, where you'll find thousands of free programming courses curated to help you grow as a developer. So plug in your headphones and join us as we begin today's episode of the Tech Sharmit podcast.
Hello everyone, welcome back to the Tech Sharmit podcast. Today I'm joined by another very special guest, Asma Merabet, who is joining us from Algeria. Asma is a Google developer expert in AI, a PhD student, AI researcher, backend developer, and data analyst. Her work focuses on applying medical intelligence in healthcare. In today's episode, we will talk about her journey into medical AI. But before we get started into this, I would like to thank Asma for joining us today in this episode. And now I request you to please initiate the discussion by telling us a bit about yourself.
Okay, thank you so much for this invitation. It's really pleasure for me to share with you my experience during this episode.
Okay, all right. Now we are going to start the discussion. But before we talk about the technology or the field that you have worked upon, I just want to know about the initial life of your journey. So, like you are a PhD student, Google developer expert, AI researcher, and backend developer, and that's a quite a lot of hits. So, what's the origin of the story? Like, how did a kid in Algeria end up at this intersection of medicine and machine learning?
Well, it's really started with two things I love. The first thing is that I really love problem solving. That's why my major was computer science, and the second thing that I love helping people. So during also my master, I have worked on a clinical system. I was building a clinical system to support remote collaboration work between medicines. So in this system, they were able to make the decisions and also decisions in collaboration, and the information sharing was very easily. So, because when you work with healthcare, you are going to notice the gap. The gap in this sector was that doctors are doing their best,
Mhm.
but they really have some challenges. For example, the time, the tools, and the resources. And since we know that AI is something that can help people at any sector and in any major, I was thinking, why don't just use the AI to organize this and this, and especially since the AI can help to detect patterns very easily and accurate. But for sure, with explainable, because doctors cannot they cannot just trust the model you implement. And yeah, so today I work at that intersection to first in the research to improve AI models to have the best accuracy, and then the engineering, and in which I make those models usable in the workflow. And that's why I am also doing the backend development. So in fact, I didn't plan to have lots of hats. I just followed the problem. So I found myself here, and I try always to help as much as I can.
It's great to know that how you integrate the technology with the medical science, because I think this is the best use case of AI also. If it is helping us to diagnose the disease or to provide the better treatment, I think this is the best way that anyone can utilize AI in the medical science.
Yes.
Yeah. So Asma, you also work on the multi-cancer screening using the AI applications. So can you please walk us through like what that actually looks like in actual practice when you are screening this process of multi-cancer?
Yes, so for the multi-cancer screen, what does this mean? It means that I train a model to look at the data. Usually, I work on the image data set, but it can be text data set also.
Mhm.
Then what I try to do, I try to detect the things for different cancers. For example, breast cancer, colon cancer, skin cancer, any type of cancer. We can we can summarize the journey as follow as a cycle. The first thing is we should understand the need of the clinical, if they need the classification or prediction or just like risk scoring. After that, we go through the parts of preparing the data. Generally, it's collecting data, then organizing data, and then cleaning the data, and then building the model. In this step, we implement the model for high accuracy. But this is not only our focus, because we are dealing with something very sensitive. It's the healthcare of person. We are not
Correct.
looking at data as only data, but we are looking at data as a person. So I don't just focus on the accuracy, but I try to analyze the error and why this is wrong. This is in the step of the testing the model. After that, we and this is the most important thing, as I see in my opinion, is to make this model understandable. It's not enough just to have like a high accuracy models, but to make it understandable. How I make it understandable from medicines and doctors is to add the explainability. So now the doctor can see where the model is focused and take the decisions. And at last step is to think out the real use.
Mm.
Is it possible to use this system, and where can I put this system? So uh, and for me, a typical research day is a balance, and it's not a routine, because sometimes I just read papers,
Mm.
try to extract the gaps, and because based on those gaps, I find new contributions and work on them. Sometimes it's experiments after finding the gaps, sometimes it's writing papers, sometimes it's collaboration and meetings with doctors and engineers for collaboration, because research needs
Yes.
collaboration. And but the most of days are documentation, because I need to write everything. If I find like a new idea, I should write it. If I have something to do, I should write it in my to-do list. So yeah.
Okay. So the way you have explained the entire process of research and collaboration, it sounds very simple, but I know like it's not that simple for everyone
Yes.
because there are
Yes.
so many challenges, right?
Yes.
Because mainly for such kind of researcher, like you are supposed to collaborate with clinical expert researchers and also the industry partners. So, from your experience, like what is the hardest part of collaboration? Like it is getting doctor to trust the AI technology or getting engineers to understand the medical procedures? Because both are difficult, I think.
Yes, honestly, both are hard, but the hardest parts, I see that is getting everyone to speak the same language. Why?
Yes.
Re- Doctors don't reject AI because they hate technology. No, they reject it because they don't trust it. They feel like it's a black box for them. They want to know when can I trust it, or why I should trust it, or how it's wrong. If it's wrong, this means the safety of this person, it's in high risk. This is
Yes.
in the side, yes, this is in the side of the doctors. In the other side, for engineers, um, they sometimes forget how medicine is complex. For
Mm.
example, if they got the data, they said, "Okay, I'm going to try to implement the model because I already have the data." But it's not enough because sometimes the data is not accurate. It needs to be clean, and those details matters in the medical field. So I always spend a lot of time doing the translation, turn the medical needs into technical requirements, and try to explain the technical limits into the simple and the best clinical terms. But once the translation is done and it's well, we can get the trust in the both sides.
Okay. You just mentioned very important term, and I think this should be conveyed to all the tech expert also that doctors don't hate the technology. They are just concerned about the patient life, right? So that's a very
Yes.
important line because they are also happy to adopt the technology if it is helping in their procedures, but they are just a little bit concerned about their patients. So I think if that problem is solved, then they are happy to adopt it.
No, because I had the experience this in my paper. I implement a model, then I show it to a medicine. Well, those medicines who do the validation for me, the question was always why you said that this is accurate. Based on
Mm.
what you say that this is accurate? So yes, they really need tools that can help them because they need to save their time, they need to save their efforts so they can focus on making decisions, but they just need to know the why. That's it.
Correct. And I think explainability is also very important in terms of medical AI because it is often described as the hardest part or problem for in this particular field. So
Yes.
let's take an example. Suppose a doctor team asks you, like, what did your model say about this particular task which they assigned to you? So how do you answer that? Like, what is your approach to explain the things for, like, of course, like they don't want to understand the technical terms. You have to explain it in a very layman terminology or in a medical science terminology. So what is your approach in that situation?
Okay, in this case, I explain like in three layers. The first one is where the model saw, or what the model saw. So usually, what I did, I show them the heat maps. I explain that the model is doing this decision based on this and this. The heat maps show where is the anomaly where or where are the mistakes. So if it's focuses on on a relevant area, this means it's a good sign. But if it's in irrelevant area, this is mean like it's not a good sign. And then I I mentioned that if how sure it is, this is based on the confidence. It's like a calculation with you. I'm doing some calculation, so I explain if the case is a clear or borderline. This based on also what they know. Also, in the medicine we have like small gap. The maybe is not a case. They treat this case really different. And for the last thing, this is the important thing for medicines is to mention the limitation, because
Yes.
I always say that the model cannot guarantee, because their
Mm.
fear is if you see that this model is accurate and can classify or can predict. So what I say that this tool can help you, but it cannot replace you. The last decision is up to you. You just need the system. It's gonna help you. Uh, the explainability mention the region, so you can see it easily, but it's not gonna replace you.
Mm.
When I generally when I do this explanation and I mention the limitation, they understand it.
Okay. Yeah, so I think it's simple that whatever reports you are providing to the doctor's team, you just make them realize that it is just for your help and it is not going to replace you at all because at the end,
Exactly.
doctor's teams are the one who will take the decision as per the need. So we are just
But
providing
but
the data.
but you know what? We can say that doctors who can deal with technology and AI can
Yes.
replace the doctors who cannot deal with technology and AI. Yeah, but AI cannot replace anyone.
Humans, yeah, it cannot replace.
Yes.
And that is also a very hot question nowadays. Like everyone is talking about whether AI will take our jobs or not. So you
Yes.
can say that a person with a good technique AI skills can take your job, but not the AI. So
Yes.
same
Yeah,
goes with
true.
medical
That's it.
science also. Okay.
Yes.
And another thing, Asma, like when we talk about the AI, one phrase is very popular, that is responsible AI. So whenever you
Yes.
are working either in IT industry or in a medical science, this term is very important because that almost lost in the meaning of its overuse. So when you are overusing the AI capability, somewhere we forget that we have to be responsible while utilizing the AI technology. So,
Yes.
what does actually mean to you when you are sitting in front of a data set about a patient's cancer diagnosis? How you make sure that you are using it responsibility and we are not overusing it for the research purpose also?
Okay, so as I mentioned before, I mentioned that when I'm dealing with data, I don't see it just like a data. I see it as a person. That's why I always work with doctors for validation to make sure that the thing I'm doing or the model that I'm developing is a trustworthy one, and it's not going to like make the lives in high risk for people. The things that we should like we should respect is first we need to be fair. We need also to respect the privacy, and also the most important thing is to keep the human in control. What does this mean?
Mm,
Yes, I'm using the AI, but not like 100%. We always need to make human in control for that. So those tools are just to support the doctors or for the clinicians to make the decisions, but it's always under their control. So yes, when we deal with models, we always have to remember that we are doing this. For example, it's gonna be this model for our families, so we should take this responsibility.
right.
So you can't trust it. My principle: if you can't trust it, don't deploy it.
Mm, okay. All right. So, Asma, we talked about the research work, we talk about AI and medical science also. Now, just for the those audience like who are not familiar with the technical terms or medical science term, could you please explain maybe some of example of the healthcare AI project that had a meaningful impact on the real world scenarios in a very simple terms, like how it helped these technology integration help the patient in the real world scenarios?
Yes, well, in fact, uh, I have already worked on two projects for healthcare. The first one that's called LIVE. The LIVE is to detect some biomarkers, and then what the AI do? Try to transform the information from complicated ones to simple ones. So the person now, when he check the results, he's going to understand because the information is gonna be clear. And
Mm,
after that, suggest him some advice, some diet. For example, if you have your calcium is low or your potassium high and so on. This is one where one of the projects I worked on, but we didn't make it really in the production. It's not in the production yet,
okay.
so I cannot. Yes, I cannot say if it's really useful or not. But for my opinion, it's good. Yes, it's like a monitoring system. The second project that I'm currently working on, this is a really interesting one. It's into production. It's called Vitals. What is it? Vitals? It's like a digital passport. So
Okay.
what the patients do, for example, if you are like, we know that we sometimes lose our documents, especially the prescriptions and so
Prescriptions.
on.
Yeah.
Yes. So in this application, it's like your passport. You scan, for example, your prescription. It's gonna be stored, and if you want to visit a new doctor, other ways is from your city or your country or outside your country. What you are going to do, you are just going to show him like a code. He is going to scan, and he's going to see everything about you. So now what we are dealing now, AI can help in detecting things and also in storing your data. So you are not going to face the problem of losing your information or explaining, because we know that especially the older people, they cannot explain their situation to the doctors. So if they have this, they the doctor can easily understand their situation. Those are like a real project. That's why I shared with you.
Yeah, these are great projects, especially the one which you mentioned about the digital documentation, because it will help the patient to keep the entire history of the medical issues also, like if there is any heredity problem in the patient. So that can also be stored in that digital document, and later it can be helpful for the doctors to analyze,
Yes.
diagnose. That's a great thing. Okay. So, yeah, Asma, we talked about the projects on which you worked upon. Now, there is one hypothetical question for you. So, suppose you are provided with the unlimited resources, entire team, and all the regulation is in your favor. And now you have to, if you could solve one healthcare problem using AI or maybe any other technology if you wish to integrate with. So, what it would be and how you are going to solve that issue.
I would focus on cancer detection, because uh, for example, for the colon cancer, it's the third cause of death. Why? Because sometimes people are coming late.
Hmm.
And why they are coming late? Sometimes scanning are not available. Sometimes
Yes.
doctors do some mistakes when they read the scanner. So I see that this is like very important application for AI in the detection. And for sure we need to aware the doctors how to use it, how to trust it, and for sure build like really trustworthy systems for that.
That's a
But for
great
sure, it
vision.
must be safe and it must be like a clear confidence. Yes, those like some aspects we have to focus on.
Okay. Yeah, that's a great vision, and I'm sure with the skill set of yours and the passion, you will one day for sure find out some solution for that in with the help of AI also. So that's a great thing. Okay, so moving ahead, let's talk about the developer communities, because if we talk about the developer, so like I just wanted to know like how do developer communities in Algeria and in the MENA region different from one another? Like do you, because you have worked with both the regions, so did you find any similarities or maybe anything in terms of difference between the developers in Algeria and MENA region?
Well, I think it's like similar to all the communities. I worked with communities from the MENA region and from the outside. I believe that they have all the same energy. They are strong. They have strong community spirit. They are very motivated. Well, here in Algeria or in the MENA region in general, they really like sharing knowledge, mentorship for non-profits, and also sharing the opportunities. I can see that uh, with some groups or with some pages, they always try to share the opportunities for so everyone can get this opportunity.
Okay. All right. Okay, so now I think it's time to talk about the support system, because as a mentor, you are supporting so many other students in medical science as well as IT industry. But I just wanted to know about your journey, like looking back on your career, who were the key people around you who had a defining impact on your journey so far?
Well, I always in this point I always say that I'm really lucky for having such supportive. Well, first in all the career, my family, my parents, my siblings, they always support me. And okay, I can like classify it. The second journey is my PhD.
Okay.
For my PhD, my supervisor, because we currently working on the same thing. Yes, and also my colleague. My colleague are very supportive. Uh, they really believe on me, and they always feel proud when I do some achievements. They always feel proud. And for the last the last journey, the being a Google developer expert in the AI, literally, my mentor Elias. He's really supportive, and I always feel his support. Also, Noor, our regional lead, and also my friends, Ahmed and Shiraz, they always like play really a huge role in this journey. So always what I say that we did it. I didn't did it alone. So thankful for having these supportive friends and family around me.
Okay, all right. Okay, so like Asma, you are the first guest from the Algeria, so we just wanted to know more about this country. Although like I did a podcast with more than 29 plus countries so far, there are 160 plus podcasts now. But we just wanted to know more about the Algeria country. Although this country has contributed in different ways, both in technical as well as medical science department. But from your experience, like what is one thing about your country that you wish to share with the rest of the world?
Well, even if that we have like limited access to some fundings, to some opportunities, Algerian people are very hardworking.
Yes.
Yes, they have a huge capability of working hard. They also, as I see, they are helpful. They like to support each other, especially if they are outside the country. For example, two are outside Algeria. They are very supportive. They are generous, and the youth generation, in my perspective as a teacher, they are very talented and creative people. So from nothing, they can bring everything. So I'm really proud to represent Algeria because it's like a country full of heart, strength, and energy. And for sure, it's a beautiful country. I hope if you can visit it one day, maybe try the delicious food and enjoy the beautiful weather here.
All right. Yeah. It's good to know like how the people of Algeria are connected with each other. They are supporting the outsider also with a generous nature. So it's great to know about the unity and the nature of the Algerian people. So it's great to talk. So yeah, thank you so much, Asma, for joining us today in this episode and for sharing so much information about the medical and AI integration. Because this is something I'm sure people will love to hear about. Because here we can say that this is the technology playing a best role in terms of medical science. So it's great to know about this, and thank you once again for being a part of the show.
And thank you so much for this experience and for this invitation. I hope to see you again soon, inshallah.
Thank you.